The bones of the pelvic girdle include the left and right hip bones, the sacrum and the coccyx. We're going to look at the bony landmarks of the right hip bone from both a lateral and a medial view. Before we start, it's useful to be reminded that the hip bones originate as three separate bones: the ilium, located superiorly, the ischium, located inferiorly and posteriorly, and the pubis, located inferiorly and anteriorly. The names of the bony landmarks reflect the names of these three original parts of the hip bone that are joined and united at the acetabulum. We'll start with the lateral view of the right hip bone, and the most obvious feature is the acetabulum, which connects the hip bone to the lower limb. Located above it on the ilium is the anterior superior iliac spine, and there's a corresponding iliac spine posteriorly known as the posterior superior iliac spine. These two landmarks are connected by a ridge of bone referred to as the iliac crest. As we move posteriorly on the ilium, we see an indentation in the bone known as the greater sciatic notch. On the ischium there is a smaller, lesser sciatic notch, and the two are separated by the projection of bone called the ischial spine. Further inferiorly on the ischium is the prominent ischial tuberosity, and that arises from the body of the ischium together with the ischial ramus, which is a branch of bone that contributes to the borders of the obturator foramen. Also surrounding the obturator foramen are the inferior and superior pubic rami. They arise from the body of the pubis, which has a tubercle projecting from it known as the pubic tubercle. So the only articular surface on the lateral view is the acetabulum, which joins with the head of the femur to form the hip joint, which is classified as a synovial ball and socket joint. On the medial view, we can still see a number of the features that we've just labelled: the anterior superior iliac spine, the posterior superior iliac spine, and the iliac crest in between them. On the medial side, the ilium forms a shallow depression known as the iliac fossa, and just below that is the auricular surface, which is the articular surface that joins the hip bone with the axial skeleton via the sacrum. Inferior to that is the greater sciatic notch. We can also see the lesser sciatic notch and the ischial spine in between the two. We can still see the ischial tuberosity and the obturator foramen, and on the body of the pubis an articular surface for the pubis to articulate with the contralateral pubic bone to form the pubic symphysis. And we can again see the pubic tubercle located or projecting from the body of the pubis. So we have two articular surfaces on the medial view: the auricular surface for the articulation with the sacrum to form the sacroiliac joint. This is an interesting joint because it has an anterior synovial portion and a posterior fibrous portion. And anteriorly, between the left and right pubic parts of the hip bone, we have the pubic symphysis, which is classified as a cartilaginous symphysis.